Hello, everybody out there with type 1 diabetes. Today we're going to discuss 5 reasons for high blood sugar levels that have nothing to do with food. All right, so I'm so glad you found me. Maybe you're just finding me, or maybe you've been following me since March, which is when I started doing these Facebook Lives. My name's Dr. Jody. I've had type 1 diabetes for 40 years. These are my numbers right now. I went a little high after breakfast today, but I'm right back now into low normal range. I don't have much insulin on board, so I'm not worried about that as a low. These are things I like to teach people that I work with. I've been doing virtual practice with patients with type 1 for almost 10 years now. And I wanted to come to you guys when COVID started to just really bring inspiration and education to all of you. It can be kind of a scary time with, like, are we at greater risk for COVID or what? And, the answer really is the healthier you are and the better your blood sugar levels are, the stronger your immune system is. So I've been coming live. This is like my 13th, 14th week now, Monday through Friday, right around 3 o'clock Pacific, 6 Eastern, to inspire you with tips and education for how to get really good blood sugar levels. I've been helping type 1s get off the blood sugar roller coaster for years now. So I'm so glad you found me. So let's talk about 5 reasons why we can go high that have nothing to do with food, okay? The first one, as I'm sure a lot of us know, is when we're sick, or that also includes allergies, right? These are stressful situations for the body, so our stress hormones go up, our insulin resistance goes up, the body's trying to fight off infection. So anytime we get sick, and have allergies, that definitely we'll need more insulin. So you'll have to increase your basal rate on your pump, or maybe take more long-acting if you're on shots. That is number one. Number 2 is what happens if your insulin gets too hot, right? If your insulin gets too hot, it stops working very well. It might totally not work, or it might just really weaken the potency. And now with summer upon us, well, for most of us, no, not you in Australia, but too hot of insulin will not. Ask me today, well, how hot is too hot? And I'll be like, well, if you take your insulin and it doesn't seem like it's working, it's probably got too hot. If you were concerned about it getting too hot, and then you realize your lows aren't coming, or your highs aren't coming down, right? So beware. It doesn't always have to be on ice, but it can't be out in a blazing sun or get stuck in your car, right? Those things will it's protein, and it literally gets cooked, and the protein will break down. So make sure your insulin doesn't get too hot. Another one, well, this is kind of food, but caffeine, right? Some people will drink coffee and then they'll go high and they'll think, weird, why did I go high? Well, this doesn't happen for everybody, but be aware next time you drink caffeine is basically causes us to have an adrenaline rush. And anything that causes an adrenaline rush is going to raise the blood sugar level. The body thinks that we need some extra fuel when there's adrenaline going on, so it has the liver dump glucose into the bloodstream. So take a look next time you have some coffee. People drink coffee in the morning, and it might make you think the coffee makes you go high, but it also could be reason number 4, which is the dawn phenomenon. So our cortisol hormone in the morning spikes, and this causes blood sugar rise. It might be gradual for you starting at 5, or it might just really spike right when you wake up. Very common to go high in the morning without food. So is it really your coffee raising you, or is it your hormones? So you'll have to skip your coffee and find out. And then figure out how to make dose adjustments to avoid those highs. So I give myself 2 units of rapid right when I wake up, because I know as soon as I wake up, I start going high. So let's see, we have caffeine, we have phenomenon, which is hormones, and then of course, stress. If you're stressed right now, your blood sugar level can go up. It can go up just kind of on a low level all day, or if you're just like suddenly freaked out because, something scary happened, you can shoot up. So all these things are kind of unpredictable in terms of, how to dose for them. But if you want help, check out my website. I've got lots of resources there to help you figure out how to dose for these. Because as I always tell my patients, managing type 1 is not simple. It's not as easy as I just count my carbs and I do my basal rate and I do my correction dose, right? It's a lot more complicated than that. And that's what I'm here to help you guys understand is we've got to be very well educated to identify all of these interesting scenarios. But then we have to be really good educated guessers at figuring out how to adjust for them, okay? So please leave a comment below. I'm here to inspire the world of type 1s, you with type 1 and your family members, that we can live a long and healthy life. And my number one goal is to do that through proper education, motivation, and inspiration, which I think is greatly lacking in the type 1 world. So I'm so glad you found me. I'm all about education, motivation, and inspiration. I've had type 1 for 40 years, and I actually do shots. I hope you can get a CGM because I think this is life-changing. And it has allowed me to get better blood sugar levels than ever before. I don't use a pump, I use shots, but I help patients on pumps. I help patients on shots. And I'm just a person here talking to you to inspire you. So I hope you've been inspired by today's video. Please, if you're looking for help, if you're struggling, if you're sick and tired of a blood sugar roller coaster, I've got lots of resources for you on my website. Check it out, drjodynd.com. And here's to having a healthy, prosperous life with type 1. I'll be back tomorrow right around 3 o'clock Pacific, 6 o'clock Eastern. Bye for now.